Hi, hello, welcome back. So today we will be seeing about subcutaneous cardiac rhythm monitor code series 33285 to 33286. This is a topic which is coming under CPT cardiovascular. So we have added a playlist for CPT topics. Please do have a view. Definition: subcutaneous cardiac rhythm monitor are devices implanted under the skin to continuously monitor heart rhythm. These devices helps detect irregular heartbeats such as arrhythmias and assist in the diagnosis and management of various cardiac conditions. So the CPT code for this range is 33285 and 33286. 33285 is for insertion of subcutaneous cardiac rhythm monitor and 33286 is for removal of subcutaneous cardiac rhythm monitor. Example 1. Case of insertion of subcutaneous cardiac rhythm monitor, a 48-year-old female patient with unexplained fainting episodes. Procedure done here is cardiac rhythm monitor insertion. So we are giving 33285. Example 2 is removal of subcutaneous cardiac rhythm monitor, 58-year-old male with resolved arrhythmia issues. Procedure done here is removal of previously implantable cardiac rhythm monitor. So we are giving 33286. So tips for coding this is we have to go through the documentation very clearly, and then device identification, whether what type of device being used, and coding accuracy. For example, differentiate between insertion and removal procedure. Patient follow-up, document any follow-up services is being done, stay updated with the guidelines. So that's all about this topic. If you have any doubts, you can put it as a comment, and if you haven't subscribed, please do subscribe and share it with your friends also. Thank you so much for watching. Thank you for your time. Take care. Bye bye.